Carrie Cotton is a senior policy analyst with Healthy Living and Health Promotion branch at the BC Ministry of Health. She has a diverse background in government service, having worked in Crown Lands, the Ministry of Environment, the Ministry of Public Safety, and the Solicitor General. She is currently with the Ministry of Health working on cannabis edibles. She successfully completed her MBA from Royal Roads University in 2010 and enjoys bringing a business filter to her health projects. She genuinely values collaborating across agencies as part of a team focused on assessing and resolving the complex and challenging issues that arise in policy development. So for those of you online, if you have questions for Carrie, please enter your questions into the chat box, and we will get to the questions at the end. So Carrie mentioned the presentation portion will be about 20 to 30 minutes, with 30 minutes of discussion and questions at the end. Please help me welcome Carrie. Thank you.
Thank you, Angela and Tina, for hosting this PowerPoint presentation. The target audience for this presentation is staff who work in regional health authorities in BC, in particular, the environmental health officers. Please hold your questions to the end. I will be inviting Brian Emerson and Kathleen Perkins here at the Ministry of Health to join me in answering your questions after the presentation. These slides will be made available and have been written as a resource guide that can be referred to as needed. Health Canada is the federal lead for cannabis across Canada. In the BC Ministry, the Ministry of Public Safety and the Solicitor General, together with the Ministry of Attorney General, are responsible for non-medical cannabis in BC. The Ministry of Health provides an advice on a health perspective, and I work for the Ministry of Health. As you're aware, in 2018, dried cannabis, fresh cannabis, cannabis oils, seeds, and plants became legal. In 2019, edible cannabis, topicals, and extracts were made legal as well. These are considered the new products. Timing for new products. Processors must apply to amend their federal production license in order to offer the new products. Health Canada began accepting applications to amend their licenses in July 15th, 2019. They required 60 days to process the amendments, with the earliest amendment effective dates being October 17th, 2019. Processors must notify Health Canada of proposed new cannabis products at least 60 days before making those products available for sale. Health Canada began accepting notifications on October 17th, 2019, plus 60 days for notification. Means that we shouldn't be expecting these new products available for sale in legal stores until mid-December. Consider the implications. Edible cannabis is regulated under the Cannabis Act and Cannabis Regulations. Edible cannabis is described as products that contain cannabis that are intended to be consumed in the same manner as food, i.e., eaten or drunk. Edible cannabis is not food. And I must repeat, edible cannabis is regulated under the Cannabis Act and the Cannabis Regulation. A few points that I would like to bring forward is we are using the terminology in Canada of edible cannabis and cannabis edibles, not cannabis-infused food. When referring to non-medical cannabis or medical cannabis, we use the terms medical cannabis and non-medical cannabis, not recreational cannabis, which is used in the States. I'd also like to draw your attention to THC and CBD, which are both cannabis and applicable to these slides. All references, unless otherwise mentioned in the following slides, are from the regulation amending the Cannabis Regulation, New Classes of Cannabis. I've included the link below for your ease of access. The production of cannabis edibles is licensed, inspected, and enforced by Health Canada. Under the regulation, there must be separate manufacturing facilities for food and for edible cannabis. That is, under Section 88, the production of edible cannabis is not permitted in the same building where food is produced. Production can be on the same site, for example, land, if the production is in a separate building with separate processing facilities, such as a kitchen, a storage area for ingredients, package and distribution. It's important to understand that the federal government is responsible both for edible cannabis market and for internationally traded food. The federal government is very keen to avoid errors in production, packaging, labeling, or distribution of edibles being confused with food. Apologies. Temporary markets. Sellers must be authorized by the province to sell cannabis in retail stores. That is, they must have a retail license from the provincial government. Retail stores must be located in a permanent building or structure and be enclosed by floor-to-ceiling walls that are transparent. Are not transparent. Products must not be visible from the street. And that requirement is under provincial legislation. In addition, farm-to-gate sales are not currently allowed in British Columbia. There is some discussion on that topic, but currently they're not allowed. The Community Safety Unit of the Ministry of Public Safety and the Solicitor General, together with the police, have enforcement authority for ensuring that edible cannabis products are not available in farmers markets or temporary markets. Good production practices. In the regulation, the Federal Food and Safety Cannabis Act regulations wording for food safety is mirrored in the regulations in many of the cannabis regulations, new classes of cannabis. For example, the preventative control plan in section 88 includes hazard analysis critical control points, specifically the identification of hazards, critical control points, and critical limits, as well as the monitoring procedures, corrective actions, verification procedures, and record keeping. It's important to note also that the regulation also covers aspects of the prerequisites and provides information on sanitation requirements as well. The regulations also stipulate a maximum 10 milligrams of THC per package in section 96. And in section 101, it identifies the need for even distribution of THC and CBD throughout the cannabis product with a variability limit of 15%, meaning that the product cannot contain less than 85% of the stated amount on the package or more than 115% of the stated amount. This is important from a Ministry of Health perspective because by having a consistent amount of THC being consumed, the user can begin to understand how THC affects their body and used appropriately going forward. This is particularly keen for novice users. Shelf stable. Cannabis edible products must be shelf stable with the pH level and water activity levels as appropriate. No meat, poultry, or fish products will be allowed except in dried form, according to section 102. The promotion and the product, that's the cannabis edible product, cannot be appealing to youth. It's interesting because the industry required guidance from Health Canada on what Health Canada would fault as appealing to youth, and Health Canada had the response suggesting that a common sense approach should be applied. Industry persisted in requesting guidance, and Health Canada released the Health Canada Policy Statement on Cannabis Act prohibitions, referring to appeal to young persons. That link can be found on slide 26 of this PowerPoint presentation. And it has a variety of different concerns raised. I've listed some below. It's certainly not an exhausted list, but I thought it was interesting to take a look at the types of products that would be considered appealing to youth, including products referring to music, dance, celebrities, movies, video games, but I thought it was interesting that Health Canada also came up with the idea of no multi-parts for assembly into toys or games. I thought that was quite creative. The purpose of this particular slide is to demonstrate how a cannabis edible product moves from the producer through to the public. A federally licensed producer of cannabis product makes that product available to the BC Liquor Distribution Branch, who in turn makes that product available to the BC Cannabis stores and the BC Cannabis website operated by the Liquor Distribution Branch. In addition, the Liquor Distribution Branch makes products available to privately run, provincially licensed cannabis stores. These two types of retailers make products available to the public. It's a little different from medical cannabis. With medical cannabis, the medical cannabis producers sell directly to the public, who are authorized individuals. A little more information on medical cannabis. Medical cannabis is now legislated under Section 14 of the Cannabis Regulation. Medical cannabis is overseen by Health Canada. The federal government delegated responsibility for the distribution of medical cannabis to the federally licensed medical cannabis producers. Healthcare practitioners provide authorization for individuals to access medical cannabis. Medical cannabis producers create and maintain a list of those authorized individuals. Then they verify that the authorization is valid, current, and correct, and fill the order by mail. Medical cannabis cannot be purchased through legal retail stores in BC or on the BC web page. They can only be purchased directly from medical producers. However, authorized individuals may choose to purchase non-medical cannabis at resale stores, just like anyone else can. There's 3 levels of government that collaborate in managing cannabis edibles in British Columbia, and they are Health Canada, then the provincial legislation, and the local governments. Health Canada's role is responsible for enforcement and compliance activities with respect to federal government requirements for federally licensed producers who manufacture edible cannabis products under Cannabis Act and regulations. And of course, they have federal inspectors. Local government role, authorized enforcement officers with respect to the public consumption of cannabis, i.e. police, which are often referred to as peace officers in the legislation, conservation officers, and park rangers, and the sort. Local government may also make bylaws with respect to cannabis that would be enforced by local bylaw enforcement and local police. Local bylaw enforcement examples would be where a retail store could or could not be located. Provincial roles are divided between the Attorney General and Public Safety and the Solicitor General. More specifically, the Liquor and Cannabis Regulation Branch, the Compliance and Enforcement Division, is responsible for overseeing privately provincially licensed non-medical cannabis retail stores, where the Liquor Distribution Branch is responsible for overseeing government-operated BC Cannabis stores, as well as the online sales through the BC Cannabis stores website. It's important to note that the Liquor Distribution Branch is the sole distributor of cannabis products in British Columbia, and they distribute again to the government-run cannabis stores and online BC Cannabis website, as well as the private provincially licensed non-medical cannabis retail stores. Public Safety and the Solicitor General is responsible for focusing on the legal sale of cannabis, the illegal sale of cannabis. This slide has been included for convenience. It provides contact information for the Ministry of Attorney General, Health Canada, and the Ministry of Public Safety and the Solicitor General. The health authority's role is a role of being good partners with cannabis enforcement agencies authorized under the federal and provincial legislation. Health authorities are not the provincial primary legislation pardon me, let me try that again. Health authorities are not the provincial primary legislative authority for cannabis in BC. Do's and don'ts. If an environmental health officer discovers or suspects products are being manufactured in a facility that is not licensed by the federal government, and I remind you that the production of cannabis edibles must be licensed by the federal government. It's also inspected and enforced by the federal government. But if it's suspected that there isn't a federal license, the health officer, the environmental health officer should require that the operator immediately cease and remove the sale of products, notify agencies with the appropriate authorities, as mentioned earlier in these slides, and not confiscate or detain any cannabis-containing products. The EHOs do not have the legislative authority in British Columbia to handle cannabis products. Specifically, food safety plans. EHOs will not complete a food premise approval that includes the production of edible cannabis. As previously mentioned, cannabis production is solely authorized by federal government under the authority of the Cannabis Act. Recording information. It is suggested that environmental officers, EHOs, do not identify cannabis in inspection reports as not in compliance, as these reports are posted publicly, and such practice could unintentionally provide adverse advertising for cannabis products. Health authorities are encouraged to support the intent of the cannabis legislation by working in collaboration as good partners across the cannabis mandate. The last two slides of this presentation include a variety of different links for the provincial, local, and federal government that may be handy going forward.
Yeah, thank you, Carrie. So we'll go to questions in the room here at the BC CDC first. Do we have any questions? Carrie, go ahead.
Hi, thank you for the good presentation. You mentioned that EHOs cannot confiscate the product. I'm wondering if EHOs have the legislative authority to ask for the license from the producer or the retailer.
Hey, what I hear you saying is you're asking whether or not environmental officers have the authority to ask for the federal license.
Correct.
The federal license should be in a production facility, should be posted and should be readily available. And yes, they do have the authority to ask for proof of federal license.
Hi, this is Eleni Galanis at the BC CDC. Thank you for that overview. We've been in contact with Health Canada regarding, in fact, they have contacted us regarding what they would expect us to do if edible cannabis is found to be contaminated with pathogen or a toxin and leads to an outbreak. So we're in discussions with them. What's still unclear to us is what if an edible product, for whatever reason, leads to an outbreak or a large number of people becoming sick with anything, whether it be GI illness or other illness. Where does that information go, and who is responsible for investigating that? And how do, I assume health authority staff would be among the first to be aware and implicated. How do we work with all the agencies that you have listed in order to investigate that kind of an occurrence?
Thank you for the question. It is a rather complex situation in that I agree that health authorities being in the local area are most likely to be notified of an outbreak. I think it's important to also recognize that the federal government has legislative responsibility for the production of the edible and also for production and licensing of edible. They would also be responsible for leading the investigation and the recall. I can't imagine that they would do that, though, and not collaborate with the government as they should do so. I think it's really important that being at the local level, that we're providing us information as much as we can as it's requested by the federal government. But I would have to suggest that during a recall or an outbreak, that the direction come directly from the federal government, because the federal government has the primary legislative ability for the investigation and for ensuring that the products are safe.
Sorry, Carrie, you're cutting out quite a bit on the phone. Are you in a different room now? Are you in Brian's office?
No, I'm not. I'm in the same room. Apologies. Would you like me to repeat my answer?
If that would be.
Well, I guess it's Eleni here. I'll just try and summarize. It sounds like you said that it would be Health Canada who's responsible for investigating any illnesses. However, I find that difficult to understand given that they're in Ottawa. My understanding is that the people here in Health Canada locally do not have the capacity to investigate illness reports. And so I'm just wondering how we would collaborate, given that most of the time the health authority staff would be the first to be made aware of an illness cluster, which may not initially be attributed to cannabis.
Okay, I want to be very careful that I'm not speaking to what Health Canada should or shouldn't do, or their resources or capacity to do the work. What I'm specifically saying is that Health Canada has a legislative obligation to lead the investigation, and it would be my expectation that they would participate with local government. How that would look and what would happen through that process would have to be guided by Health Canada. That's not something that I can specifically speak to because I don't have the authority over their staff or how they manage their mandate. But I can say that the legislative responsibility for the production of cannabis edibles rests with the federal government. Can I ask that people mute their phones? I'm wondering if that's why potentially we're having some glitches.
Brian Emerson here, for those on the line. I'm acting Deputy Provincial Health Officer. I would see that kind of an outbreak situation being handled very much like any food outbreak situation which involves products that the federal government is regulating, but that is affecting, British residents. And we do have those kind of multi-jurisdictional protocols that get put into place when there's an outbreak. So I would see that protocol working just as well for this situation as it would for a contaminated manufactured food product that's making people sick. I'm not sure that there's a huge difference, but as Carrie said, when it comes to the cannabis aspect of it, the federal government there would be another involvement of the folks from that branch in the process that wouldn't be involved in a foodborne outbreak.
Thanks, Brian. Yes, that's what we were told by Health Canada, that they would collaborate with us. Health would take the lead in the investigation if the edible cannabis was known or suspected to be the source of a pathogen or toxin-driven outbreak. What I was asking was about the more of an adverse event type of situation. That's okay. I can take that offline.
A related question that I was thinking about is that, for example, if there's a foodborne outbreak, public health has the authority to request any food samples and test that. But in this case, it's a cannabis product. Can public health in BC not request that product for testing without Health Canada's approval? Because sometimes these things are time sensitive.
Well, I think for product testing, you'd want to work very closely with Health Canada. They have labs for testing for those types. If you're thinking of a toxin related to the cannabis product.
Yeah, it's Natalie here from the Environmental Microbiology Lab at BC CDC. So I would assume that in an outbreak scenario that Health Canada laboratories would take authority on testing any edible cannabis product. Is that correct?
I would think so. They certainly they are requiring producers of cannabis products to do quite a range of testing on the products that are being produced. They're doing microbial testing, pesticide testing for the various cannabinoids. Cannabinoids. So yeah, they would have the knowledge about the labs to do the testing to look at any toxins related to the cannabis in the product.
But and then for the microbial content, that would be my concern. Would be something like a salmonella or E. coli outbreak in a food product, and just knowing having that clarity in advance, where to send that product to make sure that it's tested? Because I don't think a private lab would be suitable to do this kind of testing. It would have to be a government lab in an outbreak scenario. And not, right. I don't think we've never explored that as a public health lab for here in BC.
Right. I mean, I could see a potential role for the public health lab to be doing testing for those contaminants as new test for microbial contaminants of food products. I think if people could put their phone on mute, that would be helpful. So yeah, I was just saying, I see a role for the public health lab to test, as they do test microbial contaminants.
So that brings me to my next question, which was, I'm aware of the testing, the microbial testing that's required by the producers for regular cannabis, but for the edible cannabis, I didn't see anything in the presentation about what they're testing for. Do they have to do specific testing again once they produce the product, or is the testing that initially happens at the cannabis level before it goes into the food product, is that considered all that they need?
Yeah, that's good. I don't know what testing is actually required for the finished products.
Okay. Is there someone that you could put me in touch with to follow up on that? Someone at Health Canada, maybe?
Yeah, we can follow up on that.
All right. Any other questions in the room? Go ahead.
Hi. Thanks for the presentation. It's Michael Schwant at BCCC. Understanding that a lot of the changes to the regulations around cannabis have been motivated by improved health outcomes, potentially for young people who are accessing the substances or not accessing them, and also for people accessing a safe and regulated supply. Are there any long-term plans to monitor the health-related impacts of this policy change in British Columbia, whether looking at mental health or more acute impacts as well?
Yeah, so you're asking, Michael, what is the evaluation plan for this major policy change?
Yeah.
As I think Carrie mentioned, this initiative is at the provincial level. I can't speak for the federal level, although I know that there is federal obligations to evaluate this whole initiative. So we've been working with the federal government in terms of the data and monitoring working group that's developing frameworks for tracking various indicators. Similar activities happen at the provincial level, coordinated through the Ministry of Public Safety, Solicitor General, the Cannabis Secretariat. So evaluation is high on the radar for both federal and provincial officials. Because you're right, it's a big experiment. No one's ever done this before, so there is definitely interest and commitment to track and monitor this. In addition, the Canadian Institute of Health Research have established what they're calling an integrated cannabis research strategy, and they're investing substantial funds in terms of sponsored research. Some very specific streams are related to monitoring the impacts of legalization. So there definitely is activity happening in a range of areas to evaluate this experiment.
Thanks, Brent.
Just a practical question that follows from questions from Eleni and Mike, and that's what happens if, in the course of a foodborne outbreak investigation, food is identified at the residence of an individual? What's the role of health authorities vis-a-vis that in terms of its taking it in and having it sampled? Should we contact Health Canada to come in and be involved with that? That's the first question. The other one has to do with how rapidly these things happen. Health Canada is not known for being fast. So, and often in an outbreak situation for some of the pathogens that were brought up here, or even a chemical contaminant, one would want to know fairly quickly. Is there a way that this can be expedited in order that the outbreak can be, that the source can be properly identified and managed?
Right. Yeah, Tom, but Brian here, going back to sort of that scenario that if I understood Eleni's scenario about outbreaks would be, if you've got some indications that it's a microbial problem, and it's a food product or an edible product that may be implicated in an edible cannabis product, it may be very expeditious actually for the testing to be done by the provincial lab on those products.
Hi, it's Marsha here. Thank you for the presentation. I have a question regarding legal versus illegal products. So in an investigation of a complained cluster of illnesses or even a lab-confirmed pathogen of some sort, what if it's determined that this product is actually not coming from a licensed facility, therefore Health Canada no longer has the regulatory authority for it? Because based on conversations that Eleni alluded to, we've had with them, they're very clear that they have responsibility for licensed products. If it is identified to be an unlicensed product, therefore not regulated, we've been told RCMP is the lead for all of those products. Is that the health authorities would not have any mandate? Can you comment on what you're thinking about for that? I'm sure the RCMP will not want to be inundated with multitudes of potential like this. I'm just not sure that'll be high on their priority radar.
And again, their access to micro labs.
I'm not even worried about them testing it. At this point, it's what action? Who's responsible for doing trace back, looking into the facility, finding out where it came from? If it's not Health Canada, who is it?
Yeah, I would agree in terms of, if it's an illegal product, it's clearly, you're aware that it's an illegal product. Definitely the police are the ones that are the lead on that. So whether it's RCMP or local police, I think.
So this would be like food that's produced in an unlicensed facility. We wouldn't call the police. So
we would still test it.
Yeah, but if you're aware that somebody is producing a product illegally, illegal cannabis product, whether it's a food product or whatever, that definitely the police are the lead agency for that.
It's Marsha who has the authority then to conduct trace back to identify the process or actually take action at that facility if they have not just the fact that they have illegal product, but they might actually be doing, there's a deficiency in their process that is leading to illness as well. I assume the RCMP has no regulation over a mandate like that.
Yeah, no, I think that any investigation into an illegal production facility and, trace back and all the details, that would be, the police would be taking the lead and health authorities would follow the lead of the police in that scenario.
Okay, we're going to move on. Can I ask one more question to follow up on that? Then is it possible, similar to health, we're working on getting a Health Canada local contact. Is there a police contact that we could start having communication with? Because it would be helpful to start engaging in knowing when they would want to be contacted. Who do we contact and how that process works out? Is it possible to get a police contact for BC then for that?
Well, police jurisdictions are locally based. So whatever municipality the event is in, there's a chief of police for that municipality. So that's whatever.
Okay, thank you.
There is
all right.
There is a list of chiefs of police that the chiefs of the Police Association publishes a list of all the chiefs of police. If that would be helpful, I could send that.
No, I was thinking more in advance with centralized discussion around it. No, thank you. All right, we're going to move on to questions online first then. So there's a question about is Health Canada approving plans for local food premises that are preparing foods for public consumption and also prepare edibles? Is Health Canada also providing regular inspections of these food premises that prepare foods that contain cannabis for public consumption?
Certainly, this is a very big question. Thank you for it. Health Canada is responsible for any facility that wants to produce cannabis edible They're responsible for providing the license and the enforcement. That's their legislative accountability. Now, when I hear you say food premise, it speaks towards a restaurant type environment. At this point in time, it's my understanding that restaurants are not being licensed to create edible products for sale to the public. That may or may not occur in the future, but it's Health Canada who was responsible for providing the license, and yes, specifically for the inspection process to ensure that the foods that are being produced and so that they're safe for human consumption, is in association with HACCP requirements and sanitation requirements and the prerequisites that are normally associated with food under the Safe Foods for Canadians Act. I hope I've answered your question fully.
Okay, thanks. Next question. From the presentation, cannabis edibles cannot be produced in the same building as food products. So EA chose to, sorry, I'm going to skip this question because the question doesn't make any sense.
It's okay. I think at any rate, I'll give it a bit of an effort. What I hear this question asking is associated with that food is produced in one facility, one kitchen, and cannabis is produced in a separate facility, a separate kitchen, and that would include all the ingredients would be come in one particular storage from food. And I think that the environmental health officer is asking what is their role in inspecting the kitchen that is responsible for producing an edible cannabis product. And I'd like to be very clear that the EHO does not have a role in investigating or inspecting a facility that creates a cannabis edible product. That is the responsibility of the federal government. We can't have a conversation around or how the federal government wants to manage it, but it is Health Canada's responsibility to do those inspections.
All right. Any questions? If you have any questions online, please add them to the chat box. Do we have any questions further in the room or comments?
I'll ask a naive question. To go from cannabis to an edible, is there a lot of processing that is at risk of producing microbial growth? Obviously, I'm very micro-oriented, sorry, but is that step naturally hazardous in terms of microbial growth? So, for example, sprouting is a type of process where we know there's a lot of growth. When you take it from a finished product to edible, is there a microbial risk specifically?
I'm going to attempt to answer this question, and if I don't quite get it right, please let me know, because Brian's sitting beside me and I can have to chime in as well. I know that when you're dealing with cannabis, one of the risk areas of managing the cannabis is to the drying process. That's one area that can result in molds, etc. Now, when you create an edible product, there's critical times where you have to watch the development of that product through its process. For example, if something's baked, a critical control point would be that it reaches a certain temperature and is held at that temperature for a certain period of time. And if that's done, then certain types of contaminants can be eliminated. So when it comes to the production of cannabis edibles, there are the hazard analysis critical control points in place, as well as a lot of prerequisites that are associated with the hazard. And of course, the legislation does stipulate specific requirements around sanitation, whether it's from washrooms to hand wash, etc. Does that answer your question, or am I slightly sideways on you?
No, I think I was just curious about going from a plant product to something that goes into baking, like so grinding of flour. That is a step that we know that can probably distribute microbes within flour. From going from wheat to flour. And I was wondering if anything, when you're going from plant to whatever goes into these edibles, I assume that there must be a processing step in between. And if there's something around that makes us concerned, or is it or are there heat kill steps for, like you mentioned, that make sure that this product going in is fairly sterile or safer?
Oh, so sterile, or if not sterile, that they can
sterile-ish.
My concerns for food processing would be around the extraction process.
That's the question.
Once it gets into oils or butters, which may have a low final water activity, but during that processing could perhaps not have a kill step for botulism spores or Staph aureus toxin or things like that. That's what I would be concerned about. But it sounds like Health Canada has the review of the actual food processing steps to make an edible.
Okay.
When I'm listening to your question, the particular spaces in the regulation, the sections are not popping to mind for me. But Health Canada is responsible for our good partners and our very competent people at Health Canada are responsible for ensuring that the process in their licensed facilities results in safe human consumption. And I think that would include not just the biological, but also the physical and the chemical contaminants. And I know that they do testing, and I imagine, and I would have to consult the regulation to give you a more answer, but I can imagine they will have that managed.
Okay, thank you.
Okay, question from online. Is there a list of approved federal licenses that may be providing our facilities with edibles?
It's Lorraine at BC CDC. I also had that question. So approved federal facilities are often online so that you know their name and address, and that could help a lot of EHOs answer whether that premises or facility is licensed or not. So will there be an available list online just with the, the business type information?
Right. So there's definitely all of the producers are online, and the outlets that are approved in British Columbia are all online. All of the retailers are online. So that information is all public, whether it's a producer or a retailer. There would be no distribution to any provincially operated facility. I think it goes back to that question: there's no distribution of cannabis products to food premises.
So it's Lorraine, it's a follow-up question. So if I understand Eleni's earlier remarks about how an investigation might unfold, if an EHO was investigating an outbreak at a facility and there was cannabis there, they could check online to see if it was registered, and if it was not, assume that it was illegal? Or should they first contact Health Canada anyways to see maybe that premises has a conditional approval or something? I'm not sure how that might look.
Thank you for your question, Lorraine. It's Carrie. First of all, if an environmental health officer is doing an inspection, they would be in a food kitchen. And in a food kitchen, it's not legal to create cannabis.
No, not an inspection.
Not necessarily. So imagine, here's how I see an outbreak unfolding. You're at a bachelor party, and there's all kinds of food, and then there's this banquet of edibles because that's really popular now. And then there's a bunch of illnesses, and we don't know, was it the salmon dip or was it the gummy bears? And so the EHO collects all this information, and they have these gummy bears, and they say, well, where did you buy these? And they said, well, I got them from this store, and here's the address. So then the EHO is going to try and follow up the gummy bear store, and was it on an approved list or not? And then what's the next step? Anyway, that's just how I see things happening.
All right, then it would be my understanding that the environmental health officer, who again are our eyes and our feet interacting in our societies, would come across potential contaminated edible cannabis products, and that they would trace them back to a retail store or perhaps a homemade product. But if they trace them back to a retail store, I think that what they would have to do at that point in time is collaborate with the appropriate agency that where the product was purchased, and that would be it would either be in a licensed, it would either be through the Attorney General's office for a licensed privately owned retail store, or it would be through one of the cannabis the Provincial run store. And if it wasn't through either of those, it was through an illegal store, it would be through Public Safety and Solicitor General for follow-up as an illegal sale. Again, I think that what we have to do is we have to understand that the health authorities, the environmental health officers, need to be working in collaboration with the appropriate legislative authorities, both provincially and federally. Kathleen, would you like to add?
Hi, Kathleen Perkin here. Just wanted to add that there is a list online of all the provincially licensed retail outlets, so it is possible to check whether the location is licensed.
It's Marcia Taylor, sir. I think I found the list. I guess I'm just wondering, is it, what I can see are kind of like the bulk producers, or is it actually down to the level of like the retail premise that a health authority would visit?
Yes, it is. So the retail licensing is done provincially. So the list will be on a provincial website, whereas the sort of list of producers that would be on the government website. I can send out a link to the provincial retailer list, if you like.
I think that would be great. You're right. I found the federal one, not the provincial one. I'll go back and look now. Thank you.
What I'll do, is that Martha, was that you? What I'll do is I'll go into the end of the slides and I'll take the links that Kathleen's going to provide and I'll add them to the links at the end, 26 and slide 26 and 27.
Thank you. Thank you.
Okay, we have a comment online. I suspect that despite what is allowed, once edibles take off, they are going to pop up in some form of sales, either in specialty shops, markets, and even restaurants that PHIs inspect. Will Health Canada get involved in the enforcement of shutting down these potential sales?
Did you want to step in, Kathleen, to that?
So if we're talking about retail stores in BC that are not from a licensed retailer, so an actual store that has a license, that would be the community safety unit that would enforce that. So that's a provincial group set up by the Ministry of Public Safety and Solicitor General, and I can provide a link to their contact site.
Those links are already in the slides. They're in the slide 26 and 27, and they're further up in the so.
Yes.
Okay, thank you. Another question, aside from production, what about the retail stores? What is the EHO's role when the cannabis edible is on the same shelf as ordinary food products?
Okay, sure. So, so in BC, cannabis stores are licensed for cannabis retail, and they're very restricted in what kind of products they can carry. So they can carry cannabis products and they can carry accessories, which are things you need to use the cannabis products. They're not allowed to carry any other products. So including food products. So they're not allowed to sell, say, for example, candy bars and things that contain cannabis. So if you come across a situation where a cannabis edible shares a shelf with, say, a regular candy bar or some other type of food, what you probably have encountered there is an illegal retail situation. So that would be referred to that community safety unit or the police.
Yes.
Yeah, and if you do have reason to think that this is actually a licensed retailer doing that, then that would be a message to the liquor
office. Yeah.
Well, depending on whether it's public or private, so it would be basically the liquor and cannabis regulation branch that would be interested in hearing about that.
Thank you. So another question came in. Are there any limitations on types of foods that can be produced as a cannabis edible? For example, candies, sweets, etc., that are generally more appealing to youth. How is Health Canada regulating producers to ensure that there is limited appeal to youth?
All right. There has been some pushback, as you can imagine, from industry looking for more guidance on what it is they can and can't do, not only with the actual cannabis edible product, but with the marketing or the labeling, not the labeling, pardon me, the packaging of that product. Health Canada has been very, very general in what they're looking at. They want a common sense approach. So what they've done is they've created a situation, and correct me if I don't have this quite right, Brian, but they've created a situation in where they've provided guidance on what is appealing to young person. And there is on slide 26 that I mentioned earlier when I was doing the presentation. They've provided guidance to the industry that if the industry steps over the lines and they create something that's obviously appealing to young people, for example, gummy bears, that they will not allow that product to be sold or to continue to be sold. So industry is in a position where they can come up against the line as close as they want to, but it's very costly for them if they invest a lot of money into making a product. And you have to understand they have to invest in actually creating the product, the kitchen. They have to invest in how they're going to market, how they're going to package, their labeling, etc. And if they get a product so close to the line and they make it available, Health Canada will simply not allow them to distribute and sell that product. So they are motivated to adhere to the directions that have come out from Health Canada. Did I get that right, Brian?
That's correct. And there's another aspect of that question, which was limitations on products. And manufacturers are not allowed to add nicotine, alcohol to cannabis products.
Non-naturally occurring caffeine. So that would explain why chocolates are allowed, because there's naturally occurring caffeine in chocolate.
Thank you, Carrie. I don't think we have any more questions online. Any questions in the room?
Yeah, can I ask a question? So this is Alyosha Taramchich from BCCBC. So edibles are not considered food, yet they are made in plants that function as food premises. So I'm wondering how much Canada has experience with inspecting food processing plants. Are they considering expanding staff, like new staff?
Health Canada did staff up quite considerably to implement this whole process. Now, it did include hiring a large number of inspectors to inspect their, so that they could license these federal factors, and they have a whole federal food inspection that they've been working closely with.
Okay, thank you very much to Carrie, Brian, and Kathleen. We're out of time today, but if you have any more questions, feel free to email Carrie directly, or if you don't have her email address, feel free to email me and I will forward them to Carrie. And thank you everyone for joining with us today, and have a great rest of the day.
Thank you.
Thank you.